Project Independence partnered with Marin General to set up our own medical respite program, and we were using hotels. And we would put the patients in a hotel supported by Sutter Home Care. Meals of Marin provided them with their meals, and volunteers would go and visit, get them back and forth to the doctor. And so, voila, we had a medical respite program, but it was expensive because it costs maybe almost $400 a week for one person to be in these hotels. So we had to try to look at creating a system change and having several entities come together to make a community respite program available. So we have, with Project Independence, a program called Bridges, which is a dialogue at the hospital quarterly. We go to Marin General, the people in the hospital meet with the providers in the community, and we problem solve. And so at one of these meetings, we talked about the large tsunami of homeless coming out of the hospital, and we brought a program from Alameda, which was a grant-funded program, just like we were, over in Alameda, working with the Alameda Medical Center and the Alameda Community Programs. And the Alameda Community Programs was setting up a shelter for homeless people and providing medical respite. They did a wonderful job, and they came to our Bridges meeting and explained it. And then they listened to what we had around the table, and the woman who came said, "You've got all the components. All you've got to do is put it together," which we did.
The Medical Respite Program is a collaboration with all the local hospitals, Kaiser Nevada Community Hospital and Marin General Hospital, and we work together also with Marin Community Clinics. And what we've put together is a 5-bed medical respite for homeless people who are getting released from the hospital. And the hospitals are tasked with keeping people who are medically frail until they're quite, a little bit more on the robust side. So they're very happy to have a place where they can send people who've maybe had surgery and need a place to recover that is not the street. So Marin Community Clinic has offered to be the primary care provider so that the person ideally leaves hospital, has a Marin Community Clinic appointment that same day, and then we pick them up and get them into the one of the 5 hospice, medical respite beds, 4 at New Beginnings Next Key shelter, and 1 is a motel room. So currently we have 4 male patients, all from Marin General Hospital in the medical respite beds at the Next Key, which is adjacent to the New Beginning shelter, and we have 1 female from Kaiser who is in a motel room. And because it tends to be 3 male to 1 female homeless, I have a feeling the female's probably always going to have the motel room, because I think we can stay full with men. And the one thing I want to say about the program is the goal is also to help the person move out of homelessness. So it's not just a medical respite bed, but we work with staff at New Beginnings, and we have an eligibility worker to start the process. Many times when people have a major illness, 2 of our people almost died, they awaken and they want to do things differently now that they're awake. So those people are in the process of getting general assistance right now, and have the goal to move into New Beginnings General Shelter once their time in medical respite is done. Whereas before they had this incident, they were just out living on the street and really did not have any intention to come into shelter. And another one of our clients had his own upholstery business up until 3 months before, and it went downhill. Economic downturn, plus he wasn't feeling well and he had open heart surgery. He feels much better now because he had a valve replaced, and he's also looking forward to moving into New Beginning Shelter. So that's 3 of our 4. And our female patient is a 24-year-old heroin addict who is now in recovery for now. We are hoping to keep that going for a while, and we're working to get her into Marin Services for women. She wants to go back. She's a junior at Sonoma State. She's going to try and get her through Marin Services for Women, and she has a desire to go back to school. So, and then the fourth male is multiple medical problems. We just got him yesterday, but we're working with him as well on mobility issues and also with the eye towards placement within a month, hopefully at New Beginnings. So that's our program. We work with Rita Wittergren. We work with the students. Yesterday we just had a big flu clinic over at St. Vincent's, gave 44 people a flu shot. And the thing I notice with our program is we're identifying way more need than we have resources for. People see me as a nurse, and so there's so many more out in the homeless community that really need medical case management. So I think the goal for us for now is to show the need, and hopefully the services will follow. Okay, so the backpacks were a wonderful gift from Health and Human Services, and they had enough to give each person in HHS an emergency backpack with a wonderful dynamo flashlight in it. And then when we handed them out, people started to have questions about, well, are they mine to keep, and is this all I should have in there? So although we had put literature in the backpacks so that people could read and see, well, add this or that, clearly there were still some questions. So we arranged spontaneously to just go around to every work site and give little disaster backpack presentations, which were very well received. Everyone seemed to really appreciate the information as well as the backpack, as well as the fun prizes we gave for playing Disaster Jeopardy with us. And it just was a very successful project of backpack acquisition and distribution, and hopefully it will help all of our employees be better prepared to respond in a disaster.
The trainings after we passed out the backpacks were actually the fun part. People loved their backpacks, and then they came into the training. They were short trainings, mostly half an hour, and we would usually talk in the very beginning about what was in the backpack and what was not in the backpack. And my favorite thing was to pick out some poor woman in the audience who had high-heeled shoes and, mention that that kind of person needed to have tennis shoes in the backpack. So that's an important thing to have. And then we would play a game, and it was basically sort of preparedness Jeopardy. And we had 3 or 4 categories, things like equipment and supplies that you need to prepare ahead of time, safety first, and then a whole genre of questions about what you have to do as a disaster services worker.
So the immunization task force really was born out of trying to analyze, identifying why we thought possibly our childhood immunization rates were low in this county, and then also why our personal belief exemptions were actually increasing. And so we convened kind of as a pilot study, and we involved our epidemiologist, who is Andrew Horvath, and provided him with data that looked at our rates and then compared them to where we are now to where we need to be for Healthy People 2010. And what we found out that our rates weren't quite as bad as we thought they were, but there is some work that needs to be done. So realizing that this is really public health, it's really a community effort. It's up to the health department to really kind of spearhead this, but it's really needs to be a collaborative effort with the county or with the entire community.
Right.
So we started a task force, and we sent out invitations and just asking for input from people and who we thought would be very valuable members. And we have gotten the public health nurses involved. We have gotten the Marin Community Clinic involved, their doctor. We have got the Marin County public school nurses, or the school nurses involved. We've got David Witt, who is the infectious disease doc at Kaiser. So we've really come a long way, and we've been up. We meet quarterly, and we've been going about a year, and we've made great progress. And we did a pilot study on school-based IZ clinics for children.
We looked at the numbers at each school. We looked at the percent that were people who had opted out completely and the percent of people who were just missing, like boosters, for example. we came up with 4 schools that had the highest numbers of conditional entrants. And we went through a long process where we basically had to go through the school districts, get permission to run this pilot project, and then go to the schools and work it out with them. What we wanted to do was identify the students that needed their vaccinations, and then go to the school on a particular date. Ahead of that time, send out release information to all the parents so they could sign and allow their children to be immunized and fill out all the proper forms. And so we ended up carrying off this whole project. We ended up vaccinating about 25% of the kids that needed to be vaccinated. So for a pilot project, it was a pretty successful pilot project.
Binational Health Week is really, really exciting, and particularly this year because we had 10 different events across the county, which is more than we've ever had in the past. You know, we started in 2004 with one very small event, and since then we've really changed the way that we look at Binational Health Week. The initiative itself was a partnership between Mexico and the United States and grew to include many, many more countries. I think they're up to 7 countries, some of which are Guatemala, El Salvador, Ecuador, and a few others. And one of the really cool things about that is that the Health Initiatives of the Americas, which is also affiliated with the UC Office of the President, has taken over helping us with media, with outreach, with relationships and relationship building. So the regional group for Bay Area has helped us a lot. And in Marin, the great part is that people have come looking for us. So we have the same funding through public health that we've had all along, but we've been able to leverage resources really differently. We've been able to get people to come and play together in the name of health differently than we have in the past. We have schools playing with this year for the first time ever. The Novato School District has 2 of their elementary schools have worked with us on doing some health events, not only for the kids but also for the parents, and are excited about doing new programming around health for Binational Health Week in future years. We have a church group that has worked with us for the first time this year in Novato, and our ways of looking at health for Binational Health Week is far more than just those who happen to be binational. We see it as one of our community health activities, where it's important that everybody feel welcome to all of our community health activities. The Marin City one was great because we actually, for the first time, even though we've been partnering with Marin City for many years, this year we had our event in the parking lots of public housing, modeling what the the Marin City Health and Wellness Center had done with the Men's Health Outreach Days. We thought, okay, well, we wanted to be able to be in the communities where the people in need are, where the target population and wonderful people are that we want to be able to play with, but also be able to highlight the great work of the Marin City Farm Stand this year. And so that was a wonderful event, which we learned a tremendous amount. We've had other events. We continue the International Canal Health and Safety Day, where we've partnered with Marin Head Start and other groups to be able to have a huge event there. We think that there was somewhere around 800 people just in the first couple of hours that showed, and we reached capacity. We ran out of flu shots very early on, kind of showing how maybe in future years this is a wonderful opportunity to be able to really practice some of the wonderful public health options that we have and services that we have for the community. Let's see, for the West Marin event, it's so great working both with the San Geronimo Valley Community Center as well as the Dance Palace, and the West Marin organizers they know what they want, they tell us what they want, and we just come in and help do it. In the San Geronimo event, we partnered with the food bank programs, and we were able to do all of the health messages at the same time that people were coming to pick up their food baskets for the week. So we had fresh fruits and vegetables available there for tastings through our Nutrition and Wellness Collaborative. We had WIC was there. We had many alternative medicine folks that were there at the San Geronimo event, really speaking to the difference in the culture of the San Geronimo community versus the providers that... So I almost forgot, one of the really exciting things that happened this year, different than previous years, is that we got the youth community involved, and we hosted our first Look Great, Feel Fantastic, which is at the Marin Youth Center. It was a ton of fun. Lots of youth from all over the county came. We had workshops, we had dancing, we had performances, and we had healthy food and food options, of which youth were actually able to cook, serve, and enjoy.
So the integrated clinics is really a part of the very positive changes that are occurring in our community in this area. And it was really a coordinated approach to provide services and programs to our community. The campus brought together programs and services from multiple locations within the county into a single building. And it allows clients to access a wide variety of services and programs, all guided by a single set of policies and procedures, which is great for the clients as well as the staff, because we're all working under the same premise. Services that we provide include treatment for sexually transmitted diseases, HIV/AIDS, hepatitis C, immunizations, and obstetrics and gynecology. We also provide a extensive case management, mental health, and health education to the community. This year, we will be providing over 40,000 visits to more than 7,500 people. And we should have approximately 800 births this year, which we're involved with and our staff helped deliver. So that's really exciting. We're really looking to ensure that any door a client walks through is the right door for them to receive services and engage in programs that we provide on this campus.
Marin Women's Study is a breast cancer research study that we're conducting in Marin County. We're asking every woman in Marin who goes to get her mammogram to participate in the study. We're looking to enroll over 20,000 women in the study. Right now we have about 13,000 women already participating. The work on breast cancer here started 3 or 4 years back, and women in Marin County came to the county and said, you need to do something about this. The rates here are too high. County of Marin answered that call.
One of our goals was to involve the community here in Marin County on all different levels in a variety of ways. What we knew was really important was to make this what we call a community-based project. Our vision was to involve the community across a wide spectrum. We worked very, very hard to include the community's concerns about breast cancer into this project. And in doing so, it really helps to make the results of a study relevant to that community.
The results that we're going to be publishing will have not only relevance to women in Marin, like I say, to answer the question why Marin's rates have been so high, but the research is also answering questions why breast cancer, so the results will be applicable to women everywhere. I want people to know about this study. I want them to know that Marin County is trying to make a difference and is doing what we can to better understand this disease in Marin and for women around the world.